Hello, good afternoon. My name is Judson Sprandell II. I am a chiropractic physician in Canton, Ohio. I've been in practice for 39 years. Today, I thought I'd revisit seeking chiropractic care and acupuncture through the VA system. It's important to revisit the information due to the fact that there are so many veterans out there who do not know that they have the right to choose chiropractic care or acupuncture. I think the number is 10 million veterans across the country. And it's also important that I think that majority of the DCs out there don't know that they can treat veterans and have the VA cover the services that are rendered. So let's get started. Next slide, please.
Hang on 1 second for me. We have a little. Give me 1 second. I'll get this fixed for you.
No problem. No problem.
Can you see that now?
Yes, sir.
Whenever you're ready.
Okay. Veterans, okay. Technical difficulties, computers always a fun thing, aren't they? So anyway, the talk will be veterans can request evidence-based non-pharmaceutical chiropractic treatment and acupuncture. Today's information is based upon my experience in treating veterans for the past 9 years. Um, the Department of Veteran Affairs, they created a VA directive titled 1210 Chiropractic Care. The directive is dated May 25th, 2018. This document, which now includes chiropractic care in the medical benefits package, the standard health benefits plan available to all VA eligible enrolled veterans. Actually, the wording within the VA website, it states very clearly that chiropractic care is included in the Joint Commission pain management standards. And evidence shows that the patients receiving chiropractic care are less likely to use other healthcare services that are more costly and have greater risks, such as opioid medications, spinal imaging and injections, and elective spinal surgeries. And the information states that patients have lower overall healthcare costs for episodes of non-operative spine-related disorders. This is wording right in the veterans information. This is right. I've had some back and forth discussions with the VA centers, and it says, actually, this is what it states: it says, according to the 2018 Mission Act, veterans are eligible for community care when the VA is unable to schedule an appointment that is within the average drive time standard or the wait time standards. Now, chiropractic and acupuncture care falls under the 60-minute average drive time for special care from the date of request unless the veteran agrees to a later date in consultation with the VA healthcare provider. Now, this document also states that all community care requests are approved timely based on the above criteria. This is a gray area which we'll address later on. Okay, next slide. Now, VA enrolled, the veterans have to be enrolled in the VA to obtain chiropractic and acupuncture care. Okay. Now, VA enrolled veterans can request chiropractic and acupuncture in community facilities. They can receive chiropractic acupuncture care through the VA's outpatient fee-based program after referral by their primary care physician or their pain management provider. And they then receive authorization by the VA department or the VA third party administrator, which is Optum. Now, the VA referral procedure. Now, the veteran can either request care, go to a chiropractor or get acupuncture, or he is referred for that service. Now, veterans have to obtain a consultation evaluation with their primary care physician and or the pain management physician prior to entering our offices for treatment. The VA facility calls and faxes the authorization for the treatment request, which was agreed upon by the VA primary care physician and PM&R. The VA will fax the authorization to the chiropractic physician, which the authorization will list the number of treatments approved, provide copies of the medical records, which includes diagnostic testing, and will list the VA diagnosis. Now, there is definitely a VA or a DC credentialing requirement through the VA third-party administrator, Optum. DCs need to contact Optum's VA Community Care section at www.vacommunitycare.com to start the physician certification process. This is a long process. It is not a smooth process. It took our office 4 months to get approved. I would say you have to be very patient and persistent to make sure this gets done. This is not ever done on a timely basis. Now, there are standard episodes of care created by the VA Administration Center in Washington, D.C. The chiropractic treatment authorization varies in number and in duration. However, it's been my experience that the treatment frequency recommendations are based upon the primary care physician or the pain management physician. Now, usually the initial chiropractic authorization is for 12 treatments within a 90-day time frame. The second authorization is usually 6 chiropractic treatments over 30 days. The third authorization is 8 treatments over 180 days. These treatment plan recommendations can and probably will change frequently. They really don't deviate from the treatment duration. There's no extension. If you have 10 visits completed after that initial 90 days, that's all the visits you'll get. They really strict or stay focused on the treatment duration period. Now, on the chiropractic authorization form that you receive, they list the codes that they cover, and I have them listed for you. Now, the initial acupuncture request is usually about 12 treatments over 45 days, and I'm including the codes that they include as authorization. Now, the problem we have here is that chiropractic manipulation is not included in the acupuncture codes. And this is a problem for us as chiropractors who are certified to do acupuncture like I am, that we cannot do everything we're trained to do for these veterans. In my office, I do very well with treating them with both chiropractic and acupuncture. All right. Now, our documentation has to be top notch. The initial report, in my experience, should be completed and submitted to the referring entity timely. We try to get these reports to the referring entity within the first week, because upon receipt of the initial report, the VA opens the claim. The longer you take to get the initial report, the longer it takes for the claim to be opened. Now, the VA requires office notes, and they definitely request records, and these should be sent to them timely, and our notes have to be legible. We cannot send handwritten, scratchy-looking notes. We have to be better than that. The office notes must document the veteran's response to treatment, must document the improvement. Your updated progress report should also be completed and emphasize how well the veteran is doing. Best way to document improvement is to use the visual analog scales or the modified disability questionnaires that are out there, or even talk about they're able to perform daily activities with a less degree of pain and soreness. Okay, next one. Now, on the EOBs, they must have the VA diagnosis listed in the appropriate section. you do not include any of the other diagnoses. What I do is I include my diagnosis in the veteran's initial report in the assessment section. The VA also will, what they will do, they'll request copies of your office notes upon completion of the treatment authorization period. So what we do in the office, if we have initial 12 visits, treatment period, we will submit the office notes close to the time that we're finished with those 12 visits. So usually we submit them at the end, around the 11th visit. Now, when you build the manipulation codes, you have to use modifier AT, and all other physical therapy codes use the modifier GP. Now, if you examine the veteran and you adjust them at the same time, you got to use the modifier 25. So it's been our experience that manipulation codes include AT modifier, and all other codes should be a GP modifier. Now, additional treatment request is a headache for me, and it will be for all of you too. It's been in my experience that the authorizations for treatment requests are frequently delayed. There are some that are authorized appropriately, and then there's some that aren't. And it takes a while to get these additional treatment recommendations approved. It's been my opinion that chiropractic treatment plan that is ongoing and improvement is established, and there should be, and when there's a stoppage of care, which could be months before authorization is received, the progress is definitely slowed down and the improvement is lost. With these veteran conditions, treatment plans are not short-term. The duration of the treatment plans will depend upon the veteran's improvement. Improvement should be documented with clinical findings and veteran testimony. It's my opinion too that once a stationary plateau is reached with treatment, there should be consideration for a supportive care treatment plan to maintain the veteran's maximum medical improvement level of function. Okay. Now, most all veterans, every one of them, present with chronic long-standing permanent musculoskeletal pain and dysfunction. Their cases are complicated. Their previous treatments include long-term reliance upon prescription medications, injections, and multiple surgeries. Veterans need to seek non-pharmaceutical treatment, which is what we can do. Now, I am supplying 4 case examples of actual cases of mine, and these definitely document the complicated nature of these their conditions, and I'll highlight some of these for you. The first one is a 54-year-old veteran, long-standing cervical pain with previous episodes of seizures with radiating pain and numbness into his left arm. He had frequent headaches. He was assaulted by a group of men. He was experiencing sharp stabbing pain in his neck with pins and needles in his left hand. He was experiencing a burning sensation in his scalp, which radiated to his neck and mid-back. He stated that he was experiencing pain 24 hours per day. A spine stimulator was recommended, which he denied. The VA diagnosis was spondylosis with radiculopathy in the cervical spinal region. 12 acupuncture treatments were authorized. This veteran responded very well, very fast to care. The issue we had here is that we asked for additional treatments, and the authorization period was long-standing. And actually lost track of this veteran because I think he got frustrated with the system. The stress was too much for him, and I'm pretty sure he now has contacted his Medicare provider and is doing medications. So in this case, it was a shame that we couldn't continue care because of the delay process for getting additional treatments. The next case is a 72-year-old veteran. He presents with chronic pain and lower back pain. He had unsuccessful hip surgery. They actually broke a surgical tool during the surgery. He moved from California to Ohio. In California, he was receiving canisters of Vicodin on a monthly basis. Entered in my office, and acupuncture was again approved. His improvement he improved very well. We've had long periods of authorization wait time. Every time the patient was unable to follow through the treatment plan, his condition worsened. He has returned to our office now, and he comes into the office about 1 to 2 treatments a month. But in this case, this veteran did definitely experience a worsening of his clinical condition without care in my office. Okay, next case. Now, this is a 78-year-old veteran. He presented with chronic lower back pain with bilateral leg pain and numbness. He could not do anything. The VA provisional diagnosis was spinal stenosis. He was referred to our office for 12 acupuncture treatments. He had 2-year duration of lumbar pain with numbness in his legs. His treatments previously included prescriptive medications, which included gabapentin, which he is currently taking 600 milligrams of gabapentin 3 times a day. He responded very well to our acupuncture manual therapy program. He experienced improved function, decreased leg pain and numbness, decreased reliance on prescription medications. He declined spinal injection recommendations, and he was able to complete his daily activities with lesser degree of pain and numbness. I last evaluated him in December of 2020. He was asking for additional treatment, but again, the authorization period was definitely delayed, and really we've lost track of him. So this delay in asking for additional treatments remains a issue that we have to work out. Okay, the last case I have here is I have a 50-year-old veteran who presents with chronic neck and lower back pain. Pains that are pain and numbness into his lower extremities. He's had pain for about 25 years. He was prescribed up to 32 pills a day for 15 years. He had to rely on a wheelchair for about 10 years. He states his lower back pain was service related, which required him to jump out of airplanes, climbing mountain ridges. He responded very well to our treatment program. His previous treatments included injections, PT, water therapy, shots, nerve blocks, and he's prescribed several pills. He's currently taking tramadol twice a day. He improved very well with my chiropractic and acupuncture treatment. Again, his requests for additional treatment have been delayed. There's a question, and I appreciate the question. It says, if they get approved for acupuncture, does that include manipulation? No, it doesn't. This is an issue that we have with them, because they should really approve treatment for what we're trained to do. And many chiros are authorized to do acupuncture. And there should be no delay or they should not try to separate the 2 visits. I actually had a discussion with a VA nurse where she said that, well, you want to try chiropractic first. If that doesn't work, then we do acupuncture. Now, like I said before, when I can treat the veteran with both acupuncture and chiropractic, I do very well that way. And this is the message that we have to get across to the VA officials. Okay, next one. Now, I've only had one case in the last 9 years where the veteran's treatment was denied. We could not get it approved. There is a veterans appeal that I have an appeal that I can send you if everybody needs it. But what eventually what we had to do, we had to ask the veteran to contact his U.S. House of Representative or U.S. Senator. Upon contacting them, his care was approved very quickly. But this is not a real big problem. Like I said, I've only one case out of 9, but it's there, so you know that you can always appeal, like we always do. You know, I'm known for appealing adverse decisions. Okay, next one. Now, it's very important when you in the notes too, going back to the notes, is to list your treatment goals. And these are mine that I really don't need to read these, but in your notes too, you have to include that your treatment plans include lifestyle modifications, nutritional information, home treatment recommendations, and providing home exercises. Make sure you document everything that you do. It's very important that they know that we're trying to do everything we can to help these veterans because they have such complicated cases. Now, my motto is our motto in the office has always been do what's right for patients. Our veterans require everything we can to help them. They have so much pain and dysfunction for years. Just my opinion, if I can improve their pain, improve their function, increase their quality of life without prescription drugs, injections, or surgery, then I think our treatment should be continued timely. Now, action steps that we need to do. It's very important because any meetings that I've had with veterans down the road is that they don't know they can come see us. So what we can do right now is get on the education bandwagon, and what you have to do is create information packet. I sent examples of mine to ChiroSecure. I'm sure they'll send them to anybody who needs them. But I really rely on FORT, the Foundation for Chiropractic Progress. They have any information you need. They have white papers, they have brochures, they have everything, and then they'll do anything that you ask for them. So everybody needs to be a member of the Foundation for Chiropractic Progress. But my attack plan or my action step plan should be, and these are what I have included, and I have copies I sent to FRCP. I include the Foundation for Chiropractic Progress Chiropractic Care for Veterans brochure, which I had some input with. We created a Veterans Right to Poster here in Canton that everybody can use. We also have a chiropractic military benefit explanation sheet, which is 1 page, very simple. We include a pro chiropractic veteran military treatment, effectiveness, cost savings data sheet. I also recommend that DCs visit veteran facilities such as American Legions, Veterans of Foreign Affairs, and Wounded Warrior facilities. And you need to provide this information to them. And the last thing we need to do is attend and provide FRCP chiropractic information at all veteran events. It goes real well. Their information is top notch. Okay, last slide. Now, last slide, I just want to talk about 3 things real quickly. Currently, we all need to support these 3 issues. Need to support the September 2021 Drug-Free Pain Management Awareness Month. The Foundation for Chiropractic Progress has a weekly marketing guide, which I have also sent that to ChiroSecure. It has a weekly description and about submitting brochures and information, so this everybody can follow. The second thing we should do is that in November, to support the November 2021 Military Veteran Care Month. And again, the Foundation for Chiropractic Progress has a weekly marketing guide that you need to follow. And lastly, we need to request our legislators to support the increased patient access to chiropractic care bill, HR 2654. You need to ask the legislators to co-sponsor this bill. As you all know, Medicare is the basis for all insurances and most of our headaches that we have to deal with. If we can get Medicare to open up their benefit package and reimburse for what we do, it'll definitely help our Medicare patients and also help each one of our offices. But we cannot sit around and not do anything and just let everybody else do the work. You need to contact the legislators. We were successful in getting Congressman Gonzalez to be a co-sponsor to this bill. This should be done across the country. All right, so that completes my topic. I want to thank ChiroSecure for letting me share my experience with this. So next week, please join us, and Mark, the student, will be the presenter. You all have a good day. Thank you.